Macular degeneration refers to aging or weakening of the film in the back of the eye. This is actually the #1 cause of blindness in developed countries. In macular degeneration, the movie screen inside the eye or the film inside the eye, which normally registers the image, gets damaged. So just think of it as somebody starting a fire in the center of the movie screen inside the movie theater. So as the film gets damaged, then the patient starts to lose vision in the center of their eyesight. There's basically two types of macular degeneration, the dry type and the wet type. So the dry type, it's basically weakening of the retina because of exposure to harmful radiation. So it's like a flower that's wilting. When you put it under the strong sun, the flower wilts. So throughout the many decades of a patient's life, the retina or the center of the retina called the macula absorbs harmful radiation. And as they age, then the retina basically degenerates or gets weaker or gets burned by all this radiation that they're exposed to throughout life. Now, there are some patients who are very unlucky. They start out with dry type macular degeneration, but sometimes the retina will form a crack, and then the blood vessels from behind the retina will now go through that crack into the retina. And once that happens, these blood vessels will start to leak fluid and blood. When they leak fluid and blood, then the patients rapidly start to experience blurring of vision in the center of their field of vision, which rapidly progresses until the patient goes blind. Typically, if you have only dry type macular degeneration, your vision can last you a decade or more. But if you have wet type macular degeneration, you're already lucky if your eyesight will last you 2 years. Well, the main risk factors for age-related macular degeneration, as the name implies, is aging. Another one would be smoking. That's a major risk factor. When you smoke, your body will age even more quickly. A lack of vitamins and antioxidants prevent the aging process. They slow down the aging process in our body. But there are some patients who don't take vegetables, they have very bad diets, so they don't have good vitamin levels inside their eyes. So their bodies, including their eyes, including their retina, ages very quickly. Then there are other causes such as diets that are very high in cholesterol, and intake actually of cholesterol medicine is a risk factor also for macular degeneration, because when you take medicines to slow down the absorption of cholesterol, you slow down the absorption of good cholesterol as well as bad cholesterol. And some of the good cholesterols include the vitamins that protect our body from aging. So in macular degeneration, the center of the retina gets damaged, and the typical symptoms will be seeing distorted lines. Like when you look at a tree or an electric post, instead of it being straight, there's a curve to it. As the disease worsens, now you start to see a blind spot or a blurred area in the center of your field of vision. And as the macular degeneration gets worse, that blind spot gets larger and larger. So a typical patient will come in and tell you, "I don't see your nose, doctor. I can see the rest of your face." Several months later, now he can't see your face. You can see your body, but not the face. Then later on, you won't be able to see the shoulders. And then later on, there's just this large blurred area of vision in the center. So they're only able to see things out of the corner of their eyesight. So if you have dry type macular degeneration, we don't have any treatment to stop or reverse the disease. We generally advise patients to change their lifestyle, stop smoking, eat a healthy diet, and then we put them on antioxidant medications or vitamins to try to slow down the aging process of their retinas. In patients who have the wet type macular degeneration, where there's an abnormal blood vessel growing in the retina, there are at least new breakthroughs. So now there are actually medicines we can place inside the eye. These are antibodies that can make that blood vessel shrink and sometimes disappear. There are also laser treatments that we can do to burn or seal off that abnormal blood vessel. So with the medicines, many times we can restore some of the patient's eyesight. And with the lasers, we can stop the eyesight from getting worse because we can close off the abnormal blood vessel. We usually use the laser to treat patients with blood vessels away from the center of the retina. So if it's in the exact center, if we laser it, then we'll actually cause a permanent blind spot. We may make the patient's vision worse. But if it's off-center, then we can safely treat that. There are also some patients who don't want to receive injections or where injections of medicines hasn't worked. Then laser can be a second option for treating them.